Greetings of the day, folks. Today we are going to discuss about the HIV testing and diagnosis, the recommended algorithm. This is from UpToDate. Okay, so you can find more information on UpToDate. So you see here, the there is after diagnosis, like the patient. If you see here, so the diagnosis is with the HIV immunoassay. That is fourth generation, which detects the HIV 1 to 2. If it is negative, it is negative. If it is positive, then we have to rule out whether it is HIV 1 or 2 differentiation. So it is a differentiation immunoassay of antibodies relating to the HIV 1 to 2, 1 or 2. So if it is HIV 1 positive, then it is HIV 1 positive, and 2 is negative, then if it is 2 positive, then it is 2 infection, HIV 2 infection. And HIV 1 or 2 infections are positive, then both are positive. If these are negative, but fourth generation HIV immunoassay is positive, then it is called as negative or indeterminate. In this situation, we will go for RNA. So if the RNA is positive, then it is called as acute HIV-1 infection. If it is negative, then like we will look for any high risk exposure, like any high risk exposure include anal intercourse or unprotected anal intercourse or any needle stick injuries, which is very highly likely. Or if the patient is negative, then we will recommend him to get tested, him or her to get tested like 2 weeks after the first testing. Okay, so and also now we will discuss about the testing, like the time to positivity of the HIV, various diagnostic tests. As we all know, there are ELISA, Western blot test, HIV viral load test. Okay, so like how many, like from this point of exposure, from the time of exposure to the positivity rate, like how many days will it take for a test to detect your like presence of HIV in your body? Okay, so if you see here at this is also from UpToDate, you can find it there. So this is the test column, this is target of detection, this is the approximate time to positivity days. So the test is ELISA, Western blot, and HIV viral load test. There are three tests most commonly used. ELISA, in ELISA you can see here there are first, second, third, and fourth generation based on the development, okay, and further research. So in first generation, which used to detect only IgG antibodies, which used to take a lot of time, like 35 to 45 days. And in second generation, it is also takes like count. It measures the IgG antibody, but it used to take like 10 days when compared to first generation. And third generation, it takes 20 to 30 days, but it detects IgM and IgG antibodies. And the latest one is the fourth generation, which we are currently using. So fourth generation test, which includes IgM, IgG, and P24 antigens, and which will take around 15 to 20 days to get detection. Okay, so the next one is the Western blot test, which detects IgM and IgG antibodies, and sometimes it be showing an indeterminate in between like 35 to 50 days, and it will be mostly positive during like 45 to 60 days after exposure. Then the HIV viral load test, which is sensitivity cutoff at 50 copy per ml, which is it detects the RNA. When compared to here, you can see these are detecting antibodies. This is detecting RNA of the virus, which is more sensitive, and it will be detecting within 10 to 15 days. And now you can see the sensitivity is increased, so it is ultra sensitive. The cutoff is 1 to 5 copies per ml. So even with the low limit, you can detect the low amount, it can detect the virus. So it detects the virus within 5 days. Okay, this is more sensitive. These are the latest developments which are seen. Thank you for watching.